Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today I'm out at Squaw Peak, which is a gorgeous area in central Phoenix with mountains and hiking paths and cooking areas for picnicking. It's a little hot today, so I'm one of the only people here. It's about 110, but it's dry heat, right? The topic today is neck pain and arm pain after an initially successful neck surgery. So it would fall into the definition of failed neck surgery, but what can you do about it? You had a neck spine surgery that worked really well a few years ago, or maybe not that long ago, maybe 12 months. It went great, pain-free afterwards, and then the pain comes back. There are three main reasons that an initial neck surgery that did well might have increased pain or new pain a year, 3 years after the surgery. Number one, when you do a neck fusion, normally it's over 90% of the time, it's a successful surgery. Most time patients' pain goes away completely or close to completely, and they do great. But it doesn't fuse right away. If you fuse, say, C5 to C6 with some bone in between, it has to grow together. It has to weld together like two pieces of metal, okay? And what the surgeon will do is they will put hardware in, like some screws and rods with a plate, to hold it together while the bones fuse. What if they don't fuse? Right? What if it just doesn't, you get the luck of the draw, the bad luck of the draw, where the bones don't fuse together. Maybe you're a smoker, diabetic, whatever the reason. You may be perfectly in good health. It just didn't fuse together. If the screws break because of your movement, every time you move, it puts stress on those screws. If they break, if they start to loosen, you can get increased neck pain. That could be a reason for a failed neck surgery, okay? So what to do about it? Well, a lot of times x-rays can show the broken screw or the movement there. Maybe an MRI can show some light areas where it's starting to show some looseness. So that can be worked up in the diagnosis. A lot of times it might need a revision surgery, or you might be able to just get some injections, some pain medication if it's not that bad. Okay, so that's number one. Number two is scar tissue. So if you have initially successful surgery that frees up some of the nerve roots that are coming out from your neck, what can happen is over time, 6, 12, 18 months, scar tissue can form around the areas where the nerve root was freed up. So the nerve root's happy, it's doing well again, your arm pain, your shoulder pain, arm pain is gone, but then scar tissue can come back around that nerve root and the pain can return. And that is really a bad situation because you've had a great result, you're back to work, you can concentrate again, play with your kids, do the things you want to do, and then the same pain comes roaring back. Well, what can you do about it? All right, well, go back in and take more scar tissue off the nerve root is a possibility, but a lot of times scar tissue just comes right back. So that's not always the best option. Sometimes pain management with injections, medication, physical therapy, things like that can be very helpful. It may be that a spinal cord stimulator as a last resort works really well for you, and that doesn't fix the problem. It basically can just change the pain going down your arm. It can mask it and make it a tingling sensation rather than a burning, searing pain. But if you can't fix a problem operatively, or there's too high of a risk to fix it, why not mask it? Well, the pain management doctors at Arizona Pain Specialists do those a lot, and they work really well. Over 65% of the time, you can get a good to excellent result. The third reason that a neck surgery might do well and then fail is as follows. So you have C5 and C6, let's say you fuse those together. Well, C5 and 6 is right in the middle of your neck, and it absorbs a lot of the stresses normally, when you bend and twist your neck. If you fuse them together, they can't absorb any stress. Those stresses either go up or they go down. And that can go to C4-C5 or C6-C7, and you can accelerate the degeneration of the level above or below. And that can start to have very significant pain, like the joints in the back of your neck called the facet joints. Those can degenerate and cause pain. The disc can degenerate and cause pain, or a combination of those two. So, once again, the pain management doctors at Arizona Pain have very good mechanisms and treatments to try and prevent you from needing another surgery. epidural injections in the neck, facet injections or what's called medial branch blocks. Radio frequency ablation can help. That can provide 6 to 18 months of pain relief. So all hope is not lost. Our website has a lot of information at preferredpaincenter.com. Call us today at 602-507-6550 to get more information and for scheduling. The office takes a ton of insurances: Humana, Aetna, Cigna, United, Blue Cross Blue Shield, Medicare, Medicaid, all across the board. The pain management doctors are board certified and fellowship trained. They've won the Patient's Choice Award 4 years in a row. That's voted on by patients, not by doctors. And you can't purchase that award. 4 years in a row. So they have multiple locations around the valley, serving Phoenix, Glendale, Chandler, Mesa, Tempe, Surprise, Goodyear. Really is a location that can help everybody. So call today. I'm Dr. David Greene with PreferredPainCenter.com. Your pain stops here.